Good morning everybody, I'm Dr Peter Miller, I'm the Chief Executive of Leicestershire Partnership NHS Trust, and this is the January team brief. I'm just going to talk to you or so for 5 minutes, just to give you an idea of some of the things that are going on in healthcare and in Leicestershire Partnership Trust at the moment. Firstly, can I just say a huge thank you to all of those of you who worked over Christmas and New Year, who worked the bank holidays, who kept our services going. As you'll have read in the press over the last few days, it's been incredibly busy in the NHS in those first couple of weeks of January. There's been unprecedented levels of demand, but I know many of you have been working incredibly hard to keep that flow going, to keep people, so that we can admit people and discharge people in a timely fashion, both from ourselves and from within our partners at University Hospitals of Leicester. I know working in partnership with our local authority colleagues, it's really important that we've been able to do that, and hopefully as this winter goes on, the systems will continue to improve and we'll be able to see more and more people in a timely fashion through our emergency services. So thank you for that. So what's 2017 going to bring us? Firstly, as we know, we've already agreed our contracts for 2017, which will put us on a firm financial footing going into this year and into the following year after that. It's not easy, there's not enough resources in the system to meet all the demand that we want, but we need to use our resources wisely and allocate them appropriately to support all of our services going forward. We've also got a system-wide transformation plan which is going to allow us to deliver safe and sustainable services going forward over the next 5 years. The principles underpinning that are to become less reliant on inpatient care and to support people in their own homes and in their own local communities. And this will be the first year where we're really getting into delivering some of those changes. There will be a period of consultation about some of those changes, but then we can really move on delivering those 5 key issues, which are about getting people home from hospital settings in an appropriate fashion, giving them the right support that they need, that we work effectively as integrated community teams across both our services, primary care, the local authority, social services, and with our partners in UHL. Thirdly, we really need to see primary care and primary medical care as increasingly resilient, and that needs to have more resources, and in order that people can access their GP and other people, other healthcare people in that setting in a timely fashion. Fourthly, we've really got to focus on the urgent and emergency care pathway to make sure it works for everybody in Leicester, Leicestershire and Rutland. And finally, a real focus on planned care, often the management of long-term conditions, and I know many of you are involved in the delivery of those sorts of services. If we can keep people with long-term conditions well for longer, getting more control over their own long-term conditions, then we can keep them out of hospital, and that allows us to provide increasingly safe and sustainable services, both from a mental health and a physical health perspective. So that's one of the big things that we've got to get on to this year. I just wanted to mention the CQC report. As many of you have been aware, CQC visited us in early November. The report is likely to be published in the first 2 weeks of February. There will inevitably be things that we need to get on with and sort out, but I'm looking forward to getting that report, which gives us again a blueprint working forward about the things that we need to continue to improve. Finally, can I encourage you all to think about your colleagues and where we have got some really great services. We're coming up to the Celebrating Excellence Awards, and so we're accepting nominations now. There'll be a judging panel, but if you are aware of any great services out there, great colleagues, please nominate them for an award. It's a lovely evening event where we can really celebrate the successes of Leicestershire Partnership Trust, and it'll be a great way to start 2017. Happy New Year to you all. Thank you very much.